Hey everybody, my name is Troy Schmedding. I'm a general dentist in Walnut Creek, California. It's a suburb of San Francisco, about 20 miles east. I've been fortunate enough to be practicing for 30 plus years now, with a real heavy emphasis on cosmetic dentistry, as well as a restorative functional type aspect of what we do here in my particular practice. And the product I'm going to show you here in just a few minutes is really one that's true and dear to all of us in the world of adhesion-based dentistry. I can't imagine doing dentistry today without this product. And the reason being is because everything we rely on in adhesion-based dentistry is at the basis of polymerization. And so when you look at a light or look at a curing mode situation, you have to have something that's going to be reliable and trustworthy to get you to a definitive state, right? So something that's going to allow you to have an end result in your product that's going to be optimized by utilizing photopolymerization. The product I've been able to evaluate over the last few weeks is by Kerr, and it's their Demi Pro curing light. And it's their newest innovation to their product line of Demi curing lights. And lots of unique features that come with this, but simply taking a look at it ergonomically, the design of this principle of this light is that really is just a pen style, right? So it allows you easy access to the posterior. It's got a rotational head that allows me to get in different nooks and crannies, rotate from mandibular to maxillary, whatever it may be. So very nice features in that aspect. It also comes with different modes, right? It comes in different modes in terms of a standard mode, 5-second, 10-second cure. It also comes in a high energy mode in relationship to a 1-second, 3-second, 5-second cure. It also comes with some different processes in relationship to diagnosis. And one of the things it comes with is a transillumination key. So what this will allow you to do too is interpret with transillumination through caries detection, fracture detection, whatever it may be. Also comes with the accessory of a tack curing light. So the accessory that fits over the end of the curing light to give you a concentrated beam of energy that allows you to tack in cases of veneer cases and whatnot. It's got a very nice standard podium that comes with a two battery system that allows you one to be charging while the other one's in use. And then maybe more importantly, a thing that you may see here is a spectrometer. So what that allows you to do is to periodically gauge the energy of your light by simply placing it onto the spectrometer and allowing it to gauge you for efficiency and overall effectiveness. Because as we all know, we don't know exactly when our light's not working because anything can kind of cure the top of a composite. Now, in terms of the nuts and bolts and what makes this most important is the energy output and the irradiance of this material, meaning the depth of cure. So what's most important is not what's happened on the top of the material, but what's happening down deep within that box form. So ultimately, what everyone needs is a very great curing light to help make their practice, their outcome, their patients happy. And I couldn't recommend more highly one in the form of a Kerr Demi Pro curing light. Now I'd like to take the opportunity to show you a clinical case that we recently completed, not only using the Demi Pro curing light, but also utilizing the newer Kerr products that have just been introduced in relationship to their bonding agent, as well as a flowable and new packable composite. Our 58-year-old patient presented with a large occlusal amalgam restoration, fractured distal marginal ridge, and recurrent decay present. Discussions happened with the patient in regards to treatment options, and it was decided that it would best be replaced that with a composite resin restoration. Before we began, we utilized the Kerr Simply Shade packable composite by placing it on the tooth to determine the shade. It comes in 3 different shades, so it's rather easy to utilize. It comes in a light, a medium, and the dark. After proper choosing of our material, we then placed a dry shield in which we then began to remove the restoration and decay. After decay removal, a sectional matrix was then placed. At that point in time, we decided to utilize our OptiBond 360 Universal in a selective etch opportunity. We only etched the cable surface margins, go ahead and rinse and dry that, and then we applied our OptiBond 360 for the proper time that was discussed in the IFUs. We then air thinned the material very, very well, and then we light cured for 20 seconds. After proper light curing, we then utilized the Simply Shade bulk fill flowable composite. We utilized that in the format of filling that up in the box form, as well as the pulpa floor, into about 2 millimeters short of the cable surface. That's my recommendation. Now, in terms of the bulk fill itself, you can utilize that up to a 5 millimeter increment, depending on obviously the depth size of your box. Utilize proper curing once again with the Demi Pro Curing Light, allowing me proper access, utilizing that beautifully shaped pen style format that allows easy access. We use that in the continuous mode for 20 seconds, 2 10-second intervals in the particular case, and polymerize that to completion. After completion, we then utilized our Simply Shade Medium, was the color that we chose for this particular restoration. We then placed our final 2mm increments, placed it up to ideal form, shape, and then we polymerized that for before final contouring was to begin. Then we were able to finish and contour the restoration. We used a 2-step polishing system on that, and as you can see in that final result, we were able to grab a very high shine, very high finish, high quality outcome. With the Kerr product line in combination with the Demi Pro Curing Light, I don't think you can find an easier streamlined process in terms of a direct restorative process. I think it's just a great system. I've had good results with it, and ultimately I think it's a system that a lot of people would have some great success with. So feel free to take a look at that on their website, whatever it may be. Reach out to me if you have any questions. But if you're looking for something to increase your adhesion game, please do not skip on a curing light. Do not go to Amazon. Simply look for Kerr Demi Pro Curing Light and you'll be a very happy dentist.